Hey guys, Dr. Joel, welcome back. Here we're going through mold part 3. Don't forget to kill it too. Guys, if you're with us for mold part 1 and 2, we went through mold in general in part 1, talking about kind of what it is, talking about diagnosing it, where we might get mold from, what that looks like. In part 2, we went through detoxing mold. Now, I'm going to differentiate mold part 2 and 3 here today, and differentiating that's really important. So we have two different issues with mold that we need to make sure we talk about. Number one, we have mycotoxin toxicity. Okay, these are going to be the mold spores. Okay, these are released from mold, and essentially they create toxicities with the liver, the immune system, and so forth if they're not detoxed well. And remember, that needs things like B2, B3, iron, and molybdenum to detox the mycotoxins, okay? These will result in issues like brain fog, fatigue, allergy issues, sleep issues, neurological issues, and so on. So remember the difference between the spores, which are released by the mold, right? And then we have the actual mold infection, essentially, which is the actual mold or fungus growing inside of you. So essentially what happens is the spores become implanted in your digestive tract or elsewhere and begin growing into that mold and fungus. Okay, these spores are kind of like seeds released from the mold, and essentially if it's in your system long enough, you'll start growing this mold and fungus within your own body. Usually that will lead to an iron and B2 deficiency, and those deficiencies will then make it hard to detox the spores that are also there. So as you can see, this problem just kind of can create more and more problems as time goes on. This can result in a lot of issues like gut and digestive issues and mood issues, through the lowering of dopamine. So remember, when that fungus or mold is in your gut, when it's growing, you have that fungus, you'll usually have things like bloating and gas and things like that. You can even have irritable bowel syndrome from something like this. And remember that your gut is responsible for making roughly 50% of your dopamine, whereas serotonin is responsible for making roughly 95 to 99%. Some people would even say 100% of your serotonin. And so when you have gut issues, gut infections, gut imbalances, that's going to reduce your dopamine, that's going to reduce your serotonin, it's going to affect your mood, your motivation, all of these different things. Now, one of the other dangers with having this mold infection is this can actually create a loop by increasing the overall aldehyde toxicity. So remember, the mycotoxins are considered an aldehyde, which we went through that in part 2. And essentially, the breathing in those spores and aldehydes can implant the fungus, the mold in your body, usually your gut, can cause that fungus to grow. That fungus will then give off aldehydes into your system that your liver, your blood, your immune system is responsible for addressing and getting out of your body. So this cycle can continue and just go on and on and on and continue to wreak havoc. So with the mold infection, remember, you start with the exposure to the mycotoxins, okay? This will create the mold toxicity if you're not able to detox it appropriately. This mold toxicity and this mold exposure and the mycotoxins in your body plus time will eventually lead to the mold or fungal infection. Now, I've seen people that were recently exposed to mold within the last few days, the last week or two, and they don't have any kind of fungal or mold infection. And so in my experience, I think that this type of issue is usually a little bit more of a chronic issue where the infection will come on. It's hard to say if it's a month of having the mycotoxin toxicity or if it's 3 months. I would definitely say 3 months of having this type of issue. You've probably then developed a fungal or mold infection in your gut. And I would say, probably around the timeline of 2 months, I wouldn't be surprised if that was enough time as well. But it's kind of hard to say for each person. Nonetheless, it's extremely important to address the mold toxicity by detoxing, like we talked in video part 2. And then it's also extremely important, as we're talking about here, killing the mold. So how do we do that? Well, first let's talk about how not to kill the mold. So number one, if you look up on the internet, you're going to find all kinds of different therapies. You're going to find antifungal medications are suggested, allergy shots, over-the-counter medications, sweating and sweat therapies, salt therapy, activated charcoal, and there's so many other types. and suggestions on the internet. Guys, let me tell you, I I would be extremely suspicious as to if these would truly work at getting to the root of the issue. And the reason why I say that is because it is extremely challenging to get rid of this mold by killing it unless you have the right herbs or herbal combination. Now, I always tell people with infections, herbs are going to be the way to go, but you want to make sure you're using the right ones. I always have this disclaimer: you want to be careful whenever you're using herbs to treat different things. Herbs are powerful, just like any other treatments. If it can be beneficial for you, it can also be harmful. It can also have other issues that it brings on. So you really want to be careful. I mention this because I know that a lot of people that are out there searching for help, searching for support, trying to figure out their gut and mold issues, they will try anything to get relief. But guys, I really want you to be careful because sometimes these things can actually cause more issues. So make sure you're working, if as at all possible, make sure you're working with a holistic practitioner, a practitioner that has got experience in this and knows what they're doing. All right, how to kill mold, how to kill this correctly. I'm going to slide myself over here, and then I'm just going to make it a little bit smaller there. So you want to use herbal therapies like I mentioned. Now, there are 25 to 30 different antifungal herbs that I will use in the office here. And when I'm testing patients, when I'm working with patients, I'm always checking to see, do they need one herb, one very specific herb out of the 25 to 30, or do they need two, and for that specific like synergistic effect. Now, with something like mold, generally only 1 to 2 of the right herbs, herbs is key. And so it's really about if you have the right ones. Now, like I said, there's a lot of different ones. I will sometimes be checking patients to see which ones they're needing. And oftentimes I'll go through 5 or 6 or 10 before I find the herb that they need that's going to work and address this thing. Now, of all of those, there's a few that I've found somewhat more often than not. And again, this is not a recommendation to try these or start these, but just a little bit of information that may be able to point you in the right direction. Maybe you suggest this with your functional practitioner and say, hey, Dr. Joel mentioned these, having good success with these. What do you think about these? And then, I want to make sure that you're working through this with someone that's able to help you and walk you through it and help you with all that. So astragalus, Morinda, also called noni, and then golden thread, also called Chinese coptis. Guys, these may be helpful. In my practice, working with mold patients, we've had an amazing success rate. I believe it's 100% with definitely with detoxing the mold and then also killing the mold. And again, you want to do these at the same time to really support healing and really take care of this issue. I've often found astragalus plus Morinda, or Morinda plus golden thread, or astragalus plus golden thread, one of those combinations to work well. And those have been fairly common things that I've seen. However, again, every patient's different, and that's why I always recommend you want to work with someone that really knows what they're doing and they're able to find these things out for you. Guys, I recommend finding someone that is certified in systems healthcare, finding a certified practitioner near you. Guys, find a link in the description to look through that list and find someone. There's not a lot of people in the States that are available, but if there's one near you, definitely travel to see them. And even if they're far from you, I'd still recommend traveling to see them because it's going to be very helpful. These doctors, like myself, that we're going to be able to take out the guesswork instead of, hey, we think you have mold, let's try this. It's, no, let's check your body, let's test through different things, figure out if you do, if you don't, do we need to detox it? Do we have the mycotoxin toxicities? Do we have the fungus kind of growing in your gut? Do we need to kill the mold or fungus, and so forth? And so we are able to basically accurately assess and address these issues. Guys, full recovery, note this please, full recovery from mold issues, when done correctly, can and should be done successfully within weeks, not months, and definitely not years. This goes with a lot of conditions, but definitely this one. If you're on the right nutrients, if you're addressing the root issues, the body will heal itself, and it'll heal itself rather quickly. The key is getting to the bottom of those issues. Guys, I hope this has been helpful for you. I would love to connect with you. Feel free to find us online at any of our other social medias. Connect with us there. If you'd like to chat with myself, I do free 20-minute phone consultations, and am happy to help you in any way there. Schedule your first telehealth visit or come visit us in Dallas. Schedule your first new patient visit. We'd love to see you. Guys, thank you for watching this. Thanks for being a part of this mold toxicity series between parts 1 and 2, and then this part here, 3 today. If you haven't checked out part 1 or 2, go ahead and check those out. I think you'll find those helpful. If you have dealt with mold, maybe you're still dealing with mold, maybe you've been working with someone and not quite getting the right success, maybe you think you have mold, but you haven't been diagnosed or you haven't fully addressed it. I or one of our other system healthcare practitioners, guys, would love to work with you. I know that there's a lot of good functional medicine practitioners out there. Guys, we would love to help you. Reach out if you have any questions, and thanks for joining us again here for part 3, mold toxicity. Thanks, guys, and we'll see you in the next one.